Good afternoon, aloha, and welcome to the Hawaii State Senate for our 1 p.m. joint committee hearing between the Senate Committee on Health and the Senate Committee on Transportation. I'm Jarrett Kyohokalole, Chair of the Health Committee. I'm joined by member Senator Kurt Favela, and I'll turn it over to my co-chair for introduction of his members.
Hi, Chris Lee, Chair of the Senate Transportation Committee, here with our Vice Chair, Senator Lorraine Inouye, and Senator Miley Shimabukuro.
Thank you.
Oh, and Senator Favela.
Also joined by Vice Chair Senator Ross Baker and Senator Joyce-Ann Buenaventura. This meeting is being streamed live on YouTube. In the unlikely event that we need to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business on Friday, April 1st at 1 p.m. here in Conference Room 225, and a public notice will be filed on the legislature's website. For individuals testifying in person, I'll call you first with remote testifiers shortly thereafter. We do have a 2-minute testimony limit in this committee to accommodate our 90-minute hearing time. Again, we've received your testimony, your written remarks, and I've reviewed them. So I encourage you to stand on your testimony in the interest of time, or feel free to add any additional information you'd like to share with the committee that wasn't included in your written remarks. And we apologize if the closed captioning doesn't accurately transcribe your name. The first measure and only measure on this joint agenda is Senate Concurrent Resolution 194 and Senate Resolution 187 requesting the Department of Health to examine issues and barriers to enforcement to reduce noise from two-stroke engines, mopeds, and small off-road engines. First up, we have actually, we don't have any live testifiers on this measure. We have testimony all in support from the following individuals: Ted Bolin for Climate Protectors of Hawaii, John Bickle, Denise Boisberg, Kim Jorgensen, Mark Travis, Midori Marcia, Sue Trent, and Richard Schofield. Since we don't have any anyone to ask questions of, Chair Lee, are you prepared to go into decision making? Okay. The recommendation. Okay, so let's vote on this. The recommendation on these two measures, SCR 194 and SR 187, are to pass them with technical and non-substantive amendments. Members, any questions?
Sure.
Senator Favela.
So this is for the area of Waikiki only?
No, I don't believe it's limited to a geographic location.
I just wondered because SCR 194 is again, that's fine. As long as it's not just for one area. Thank you, Chair.
Since we're about to vote on it, let me double check.
No, it doesn't say Waikiki.
Yeah, it doesn't. It's not geographically limited in the resolution.
Thank you, Chair.
Okay, members, passing with amendments, SCR 194 and SR 187. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki is excused. Senator Sam Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation is adopted for health.
Thank you. Committee on Transportation, same recommendation.
Here's recommendation on the Committee on Transportation on SCR 194, SR 187 is to pass with amendments. Chair Lee.
Aye.
Vice Chair goes aye. Senator Hoyt. Aye. Senator Shimabukuro.
Aye.
Senator Favela.
Aye.
Measure is adopted, Mr. Chair.
Thank you.
Thank you very much. We will adjourn this 1 p.m. agenda right now. Good afternoon. Welcome to our 1:02 p.m. Health Committee agenda. This is a joint hearing with the Senate Committee on Public Safety, Intergovernmental and Military Affairs to hear 2 concurrent resolutions and 2 Senate resolutions. The first is SCR 208 and SR 201, urging the United States Congress and Hawaii's congressional delegation to support legislation establishing Medicare for all. No live testifiers for this measure, so I will note for the record, the American Cancer Society, Cancer Action Network in support, the Health Committee of the Democratic Party of Hawaii in support, Ronald Taniguchi in support, Jennifer Azuma Trupaliak in support, and Gerard Silva in opposition. Is there anyone online or in the room who would like to testify on this resolution? Okay, seeing none, and since we don't have any testifiers, we'll move to the next resolution, SCR 221 and SR 214, requesting the auditor to conduct a study on the relationship between the current prices of and access to medical cannabis and the volume of illicit cannabis sales in the state. First up, we have Daria Loy Goto of the Office of the Auditor with comments.
Good afternoon, chairs and vice chairs, committee members. Daria Loy Goto on behalf of the Office of the Auditor. I will stand on our written testimony offering comments on this, and just note that we do see some additional challenges with this bill, namely how to measure the amount of illicit cannabis that might be in the community. And I otherwise stand on our testimony and am available to answer any questions that the committees might have. Thank you.
Thank you very much. Clifton Otto in support.
Good afternoon, chairs, vice chairs, members of the committee. Thank you for the opportunity to provide support with some changes on this measure. My name is Dr. Clifton Otto. You have, hopefully you've had a chance to look at my written testimony. I'm proposing a very simple amendment based on the fact that both these issues, dispensary sales and illicit activity, are being directly impacted by the current conflict with federal drug law. And this is something that was briefly touched upon in the dispensaries, trade organizations 2022 report, but did not really translate into any policy recommendations. So I'm hoping that you will consider my amendment to really allow for a complete evaluation by the auditor of the impact that this conflict is having. I will be available for any questions. Aloha.
Thank you very much. I'd also like to note the written testimony of Jennifer Azuma Trupaliak in opposition. Is there anyone else who'd like to testify? Yeah, we'll go 1, 2, 3. How about that? Please state your name for the record.
Aloha members, my name is Randy Gantz. I'm the director of the Hawaii Cannabis Industry Association. We appreciate this measure. We are in support of this resolution and any opportunity to gather more data on this industry. And we think it's definitely timely. As noted, our report kind of was able to shed a little bit of light here and did take a look at some of the testimony from the auditors. And just to provide some color, there are firms and things out there, as the cannabis industry on the nation is pretty robust, that we don't need to really reinvent the wheel. There are firms that have some of this data already, and putting it together for a Hawaii specific would be really welcomed. Thank you so much.
Thank you very much.
Aloha, my name is Nolan Ward. I am Senior Legislative Counsel at the Marijuana Policy Project. Appreciate the opportunity to testify today. My comments really relate to the word illicit used in the measure. As the measure acknowledges, Hawaii's only had a delivery system for its medical cannabis for 5 years, 5 or 6 years, give or take. The preceding 15 years, it was all patient grow rights that were supplying the medical cannabis here in Hawaii. And so to suggest that Hawaiians that were engaging in legal, lawful cannabis use are illicit or engaging in some type of untoward activity, I think continues to perpetuate a stigma against medical cannabis patients. And so I would strongly recommend that the language be changed in the measure to substitute out the word illicit for the word legacy. I feel like the word legacy does capture those in the medical cannabis market that may have been producing their own medicine and that were not engaged in any illegal or illicit conduct. So I hope that the committee does take that recommendation into consideration as they move this measure forward. Thank you for the opportunity.
Thank you very much. Please go ahead.
Oh, this is exciting. My name is James Anthony. I live in Opihikau, Senator. For the last 30 years, well, proud graduate of Roosevelt High, but for the last 30 years, I have lived in California. And for the last 16 years, I have been a cannabis regulatory attorney and policy analyst. So, in general, as to this specific resolution, I agree with the previous speakers that more data is always good. I agree that the data needs to be parsed into both the dispensary pricing and supply, the current patient-to-patient transfer pricing and supply, however that's working, and the underground market, right, which is in so many ways, in so many places, the elephant in the room. I am here and I plan to be actively involved in all of this policy as it evolves over the next few years. I wish I could say that California had it figured out. California has been a massive failure. In California, the underground market still accounts for well over half of the total cannabis consumed in the state of California. And the failure there is along the lines of these policy issues that you're looking at, which will be extremely, extremely important. Number one is the number of retail outlets. Legalization in 2018, state of California had literally almost 2,000 licensed medical cannabis retail outlets. The following year, there were less than 500 legal licensed adult use or medical combined. The total taxed market went down from $3 billion to $2 billion. Those people did not stop consuming cannabis, they went to the underground market. So you want to think about that, and I'm glad that you are thinking about it, and thank you so much for this resolution.
Thank you very much. If you'd like to testify, please come forward and state your name.
Vice Chairs, Chairs, Committee members. My name is Richard Eckert. I represent the Hawaii Medical Cannabis Patient Group. We are concerned with this measure as it does not say who is going to be collecting the data, who is going to vet the data, and how it's going to be presented. We, the Hawaii Medical Cannabis Patient Group, request an independent or a UH state collaborated study in order to gain information on the number of plants and the nature of the legality of those plants would require somebody with very special resume and experience. I bring to the table Chris Whidden, who is the CEO of Hawaiian Ethos on the Big Island. I bring Jason Hanley, who is the 1,000 card holder in Oahu, and myself, having grown for 20 years in Hawaii and had another foot in the halls of neuroradiology, answering to Cleveland Clinic radiologists and taking care of Hawaii's patients and sick. We will be collecting our own data on our patient group. We will be collaborating with the University of Hawaii to get this information. We would like to be able to address the many concerns that will arise in the future. We would like to do that with data that is verifiable, data that is grounded in medical science and facts. We as a Hawaii Medical Patient Group will not accept legislation born of propaganda, born of interests of shareholders that do not have any other stake in Hawaii other than they have money invested here. We demand a change of the overall era in this room that vertical integration is a manifest destiny for cannabis in Hawaii. It is not.
Okay.
The federal government is
Thank you very much.
Thank you very much.
Thank you. Is there anyone else who'd like to testify on this resolution? Okay, seeing none, members, are there any questions for any of the testifiers? Okay, if there are no questions, then I'd like to recess for decision making. Recess. Okay, we're back into our 1:02 PM hearing on two resolutions for decision-making. The first is SCR 208, SR 201, urging the U.S. Congress and Hawaii's congressional delegation to support legislation establishing Medicare for all. The recommendation here is to pass this resolution out with technical amendments. Any discussion? Okay, seeing none, Vice Chair passing with amendments. Chair votes aye.
Chair votes aye, Vice Chair votes aye. Senator Moriwaki,
Aye.
Senator San Buenaventura,
Aye.
Senator Favela.
Aye.
Chair, your recommendations adopted.
Thank you.
Public safety, same recommendation, chair goes aye.
Members voting on SCR 208 with amendments. Chair votes aye. I vote aye. Senator Baker,
Aye.
Senator Rivera, Senator Favela. Aye. Chair recommendation is
Thank
adopted.
you.
Thank you very much. The final resolution is SCR 221, SR 214, requesting the auditor to conduct a study on the relationship between the current prices of and access to medical cannabis and the volume of illicit cannabis sales in the state. While I can appreciate the sentiment of the testifiers, I'm going to recommend that we pass this measure out unamended. Any discussion? Okay, seeing none, Vice Chair passing unamended, Chair votes aye.
Chair votes aye, Vice Chair votes aye. Senator Moriwaki,
Aye.
Senator San Buenaventura,
Aye.
Senator Favela.
Aye.
Chair, your recommendations adopted.
Thank you.
Public safety, same recommendation, chair goes aye.
Members voting on SCR 221, recommendations to pass on amended. Chair goes aye. Vice Chair goes aye. Senator Baker,
Aye.
Senator Rivera, Senator Favela.
Aye.
Chair recommendation is adopted.
Thank you.
Thank you very much. We're adjourned. Okay, good afternoon. We're convening our 1:03 PM Health Committee agenda to consider three resolutions. The first is SCR 197, SR 190, requesting the Department of Health to develop protocols for hospitals in the state to improve the treatment of patients contemplating suicide. We have no live testimony. Well, is there, we have only written testimony registered. Is there anyone in the room or online who would like to testify on this resolution? Okay, seeing none, I'd like to note the written comments of Sutter Health Kahimohala, supporting testimony from Dara Carlin. Is there anyone else who would like to testify on this resolution? Okay, seeing none and seeing as we don't have anyone to question, we'll move to the next resolution. SCR 206, SR 199, urging Hawaii's congressional delegation to strongly support passage of the Women's Health Protection Act of 2021 to protect the right to access and provide abortion services. We have only written testimony registered for this resolution. Is there anyone online or in the room who'd like to testify? Okay, seeing none, I'd like to note for the record, the Hawaii Family Forum in opposition, Planned Parenthood Alliance advocates in support, Dara Carlin, Raquel Alfson, Alfred Hagan, and Gerard Silva, all in opposition. Yeah, and that's all the testimony. So we'll move to the last measure on this agenda, SCR 213, SR 206, requesting the Department of Health to restore funding for certain substance use disorder treatment agencies for the fiscal years 22-23 and 23-24 for residential, outpatient, and adolescent school-based services. First up, we have the Salvation Army in support.
Thank you, Chair. I hope you can hear me through this thick mask. Sorry. Thank you so much for your time. I just wanted to come before you guys and just advocate for ourselves. We at the Salvation Army serve over 200,000 people a year. We provide substance use disorder treatment that's been evidence-based for many years, over 3 decades. So the majority, I'm going to stand on my written testimony, but I just wanted to make comment and come before you and just say that I wanted to advocate for ourselves as a treatment program. I think that the treatment agencies named also in the resolution stand united as well. We are friends and yet we're competitors for the same dollars. And so I just wanted to come before you and just put ourselves forward, assert ourselves, and thank you so much for your time. Appreciate it.
Thank you very much. Says on Zoom, but I see Hina Malka, Mr. Johnson in the room, so please proceed.
Thank you, Chair Ho'okaloli and distinguished members. I'm Alan Johnson, CEO of Hinomoka. I thank you for your strong support of substance abuse, and following the pandemic, we feel it will be needed more than ever. Unfortunately, due to the Department of Health's large funding cuts, despite excellent performance and outcomes, our residential and adolescent treatment programs will be turning away, and we are turning away those who come to us for help. The issue started with last year. Our adult funding was taken away for no apparent reason. We had billing activity that still remains uncompensated to this day. We were never paid for our services. Moreover, we completed treatment despite not being able to bill. Also, funding for adults and adolescent treatment for this year and next year was greatly reduced, resulting in our agencies having to deny people and kids receiving the treatment they need. We understand the new modern approach to treatment that's been promoted over the last 4 years. It's 4 points. Residential evolves to treat complex patients, and case management helps those patients in the pursuit of recovery after treatment. Residential is still number 1 on a modern approach. 2, crisis centers, crisis mobile teams, crisis beds help the most chronic get the treatment. 3, behavioral health clinics help people in treatment connect with doctors. And 4, school-based services need to be developed, which Hawaii is ahead of the curve because we have adolescent-based services here. So we believe the Department of Health needs to develop a formal statewide plan that fits the modern approaches that's based on these billions of dollars. In conclusion, we ask the Department of Health to support evidence-based practices, to pay for the uncompensated services that has been authorized, to restore the funding that was cut for adults and adolescent treatments so that we can provide the treatment that they need. And we thank you very much for your consideration and available for questions.
Thank you very much. Po'ailani in support.
Hi, aloha everyone, aloha Chair and Senators. My name is Abby Paredes and I'm the CEO of Po'ailani for 25 years now. We are in support of this resolution. With a growing homeless population and those in need of substance use and mental health treatment, this is not the time for us to be facing these cuts. Our services are needed more than ever now. The cuts that had already been made has created a tremendous impact on our population and those here in the state of Hawaii who are currently in crisis. And I want to thank all of you for your time and thank you for your support.
Thank you very much. We also have online Ray Ogai in support. Please
Hi,
proceed.
good afternoon. Good afternoon, Chair Keho'o Kalole and committee members. My name is Ray Ogai, and I'm here to stand on my written testimony in favor of this resolution, SCR 213. Thank you very much for your time.
Thank you very much. I'd also like to note for the record, the Department of Health and Support with written remarks, Candace Pang, Veronica Golozewski, and Joshua Brown, all in support. Is there anyone else in person or online who would like to testify? Okay, seeing none, members, questions? Okay, members, unless anyone wants to discuss, I think we can go right into decision making. Okay, so well, let's vote on the first measure, SCR 197, SR 190. This is the request to the Department of Health to develop hospital protocols relating to the treatment of suicidal patients. The recommendation here is to pass this measure with amendments. I'd like to adopt the suggested amendments of Kahimohala, requesting that the Department of Health develop in consultation with the hospitals those protocols. And there are also some technical amendments. Members, any discussion? Okay, seeing none, Vice Chair, SCR 197, SR 190, passing with amendments. Chair votes aye.
On these two measures, Chair votes aye, Vice Chair votes aye, Senator Moriwaki,
Aye.
Senator Sam Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation has been adopted.
Thank you very much. Next measure is SCR 206, SR 199. This is related to supporting the passage of the Women's Health Protection Act of 2021. The recommendation here is to pass this resolution unamended. Any discussion? Okay, seeing none, Vice Chair passing unamended, Chair votes aye.
Chair votes aye. SR 199, SCR 206, Vice Chair votes aye. Senator Moriwaki,
Aye.
Senator Sam Buenaventura. Aye. Senator Favela.
No.
Chair, your recommendation is adopted.
Thank you very much. The last set of resolutions are SCR 213, SR 206. This is relating to funding for certain substance use disorder treatment agencies for residential outpatient and adolescent school-based services. The recommendation is to pass these resolutions with technical amendments. Any discussion? Okay, seeing none, Vice Chair passing with amendments, Chair votes aye.
On SCR 213, SR 206, Chair votes aye. Vice Chair votes aye. Senator Moriwaki,
Aye.
Senator Sam Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation's been adopted.
Thank you very much. We're adjourned.